wanted to talk to you today about antibiotics and the misuse and overuse. Though antibiotics have saved millions of lives since first introduced 75 years ago, recent misuse and overuse have caused illnesses of more than 2.5 million Americans and 37,000 deaths of Americans each year. This is according to the CDC article on antibiotic resistance in 2015. My goal today is to make you more informed on antibiotics, the use, and to persuade you to use the information you learned today the next time you go to your medical professional, and so that you can be an advocate for you and your loved ones in the medical setting. What I'm going to discuss with you today is the misuse of antibiotics, the overuse of antibiotics, your role as a consumer and how to prevent superbugs, finishing your antibiotic prescription, and whether you even need an antibiotic prescription in the first place for your particular illness. Overuse can cause superbugs. Existing superbugs that we see and that you may be familiar with: MRSA, methicillin-resistant Staphylococcus aureus, and C. diff, Clostridium difficile. These are two hospital-acquired superbugs that you might see. MRSA is also one that you may see outside of the hospital setting. These are very hard to treat with antibiotics. New superbugs that you may be seeing more frequently: CRE, this is a hospital-acquired antibiotic, and Shigella. This is currently an overseas bacterial infection, but it's moving closer to the U.S. These are defined by the CDC website of 2015. I want to talk to you about when misuse occurs. And some of these situations happen when antibiotics are prescribed for viral infections and not bacterial infections. Secondly, when antibiotics are prescribed to satisfy the patient, not necessarily when they're actually needed for the infection that the patient has. Third, when medical professionals using antibiotics too quickly when they may not be necessary. Also, when medical professionals use broad-spectrum antibiotics to treat all bacterial infections instead of using bacterial-specific medications for their particular bacteria. Some myths that you may have heard about antibiotic use. These I really want to kind of point out because it's important that you realize these are myths. First of all, that they can cure the common cold or flu. These are viral infections, so antibiotics will not do anything for these when you get them yearly or whenever they come up. Second, that antibiotics seldom have side effects. This is a really big misconception. Antibiotics are the line of medications that usually have the most side effects. They also usually have the most allergic reactions with patients. Third, once you feel better, you can stop taking your medications. This is really where antibiotic resistance and superbugs develop. When you stop taking your medications halfway through your course, you really create a strain of bacteria that makes it hard for us to treat as medical professionals. Fourth, all bacterial infections require antibiotics. That is not true at all. A lot of them can be fought off on their own. And fifth, the more bacteria a drug kills, the better the drug is for you. That's not so at all. You really want drug-specific or bacteria-specific medication. Ways that you can prevent antibiotic resistant. This is the part that's really important for you to realize that you do have a role that you can play in this. Number one, don't push for antibiotics. If your physician says that you don't need antibiotics, please don't insist that he give them to you. There's a reason why he's not giving you the antibiotics. Second, ask if the illness will go away without the antibiotics. If it's mild, let nature take its course and let it fight it off on its own. Third, request antibiotic-specific medication. Ask if your doctor can culture antibiotics, especially if it's a respiratory, urinary tract infection. Many times these can be cultured, and we can find out the specific medication for that bacteria. And then last, avoid infections in the first place. Keep up with all your vaccines, and please wash your hands frequently, especially when you're out in a public place. The World Health Organization says we're in a health crisis over this. We really need to develop new antibiotics, but more importantly, you as consumers need to come up to your physicians, hospitals, and just your health practitioners, and make them aware that you're aware of the problem. I hope I've been able to persuade you. I hope that you can take this information, share it with everyone that you know, and realize that we are going to be the people that prevent this problem and make a dent. Thank you for listening.